Hello, this is Alex Sticchi on behalf of PCR Online, providing you the latest news from TCT 2023. Dear friends and PCR companions, it is such a great pleasure and honor of being here with the two of the most greatest structural interventionists of the world. I'm so happy to welcome Professor Robert Smith and Professor Firas Zahr. We are going to talk about one of the most interesting late-breaking trials they presented at this TCT 2023. 1 year outcomes from a randomized comparison of transcatheter edge-to-edge repair systems for degenerative MR, the CLASP IID trial and registry. As you know, the CLASP IID is the first to evaluate the safety and effectiveness of the PASCAL system compared with the mitral clip system in patients with significant symptomatic degenerative mitral regurgitation. The 6-month report met the non-inferiority endpoints, expanding the transcatheter treatment option for prohibitive surgical risk patients with significant symptomatic degenerative MR. Thanks so much, Professor Smith and Professor Zahr, for being with us for this interesting discussion.
Alessandro, it's our pleasure.
Thank you for having us.
Thank you so much. So, Professor Zahr, what is the main message from this trial, from these 1 year outcomes?
Yeah, so, the CLASP IID is the first trial that randomized 2 contemporary TEER devices, the MitraClip and the PASCAL device, head-to-head in a 2-to-1 randomization fashion. And it is important to realize that it was the newest generation of the MitraClip that was used in the majority of the patients who are randomized to MitraClip. So it is truly a contemporary devices that were used in this trial. And it shows that the PASCAL device was non-inferior to MitraClip in both the safety and efficacy endpoints. Specifically, shows very high rate of adverse event-free survival up to 1 year, with excellent reduction in mitral regurgitation. Over 90% of patients who received those devices got MR less or equal 2+ in the cohort. And as you stated, specifically looking at the patients who have further reduction in mitral regurgitation, we've noticed very high percentage of patients had residual MR 1+ or less in both cohorts. Really supporting us using TEER devices in this patient population with DMR who had high surgical risk.
Thanks so much. This is really important. I think we want to know more, reading really specifically the paper that we know we are all waiting. And Professor Robert Smith, what is the most important message according to the cardiosurgical perspective, according to you?
So I think there's a couple really important messages. Number one is not all patients are good candidates for surgery. And so now we have, in this, again, contemporary comparison, 2 devices that are out there providing excellent care to those patients who otherwise would not receive a surgical approach for repair. And that's important. So it provides hope to that patient population that otherwise may not have had such. And it provides greater access because now we have more devices out there on the market. In addition, we had the registry, which was a subset of patients who were not candidates for randomization. And in that, we had 98 patients who underwent a placement of a PASCAL device, or were at least considered for that, who otherwise would not have been typically considered in randomization or otherwise therapy. And we know that those are patients that people see, because not every patient that gets turned down from surgery is a straightforward A2P2 problem. In fact, we know that there's a broad range of problems. And so heart team practices across the country and across Europe and the US see these patients routinely and are asked to do something about them. But we have very little data that's out there to support what we're doing and to let us know what we're doing is a good job. And in this trial, in the registry, we saw excellent outcomes of 2+ or less MR. We also saw a sustained relief from MR over a period of that year, which was good. And it was corroborated by LV remodeling and improved quality of life. So when surgeons turn down patients, even though they're not all A2P2, that these patients who have disease that's outside of what is typically considered in the IFU for MitraClip, we still have options for treating those patients. And I think that was another big takeaway that the registry added in addition to the randomized trial population.
Totally agree. This is a huge, terrifically important, and I think this is a milestone for the future of transcatheter mitral intervention. Thank you so much, Professor Zahr, Professor Smith, for your kindness.
Yeah, I was going to say, it's been a pleasure to work with this guy as a part of the heart team, figuring this stuff out for the population of people, putting them in.
It's a very exciting moment for treating physicians and, more importantly, patients, that we're all coming together with more tools to treat what is, at some point considered very hard disease to treat. So we're very excited for the future.
Thanks for sharing your message, Alessandro.
Thank you.